Tennis elbow is a really common complaint that we see as elbow surgeons. People complain of pain on the outside of their elbow. Generally it's worse with gripping, lifting things. Usually comes on after some traumatic event or repetitive activity. Shoveling snow, for instance, with the recent weather, cutting meat, textile workers, factory workers will come in oftentimes with complaints. Occasionally we'll see a tennis player, but I think the vast majority of people are doing these repetitive things day to day, not necessarily playing tennis. When you're lifting, keeping your palms up, avoiding an extended elbow when lifting, anything that you have to fire the wrist muscles, the forearm muscles that help keep the wrist extended, that's really going to aggravate tennis elbow. So I tell people palm up lifting close to their body is going to be the most comfortable. Beyond that, the next line of treatment is to formally get in to see a therapist. They have specific exercises, specific tools that they can use, massage, ultrasound, things like that, that seem to help a certain number of people. I try to reserve steroid injections for people who really are making no progress to buy them some time, because it's been pretty well borne out scientifically that steroid injections provide temporary relief, but certainly is not a fix for the problem long term. I think the good news for tennis elbow is that on the order of 8 to 12 months, the symptoms seem to be self-limited. But boy, that could be a very frustrating year. I really don't consider surgery to be a viable option until about 6 months of failed therapy and non-operative treatment. So if someone has tried therapy, has had maybe an injection or two, and they're not making a headway, then I really think about offering them a surgical intervention.